Hello everyone, this is Yash Saxena and you are watching Swadeshi VIP. Through this video, we are going to talk about the bovine ephemeral fever. So what is bovine ephemeral fever? Let's talk about it. Bovine ephemeral fever is a disease that affects cattle and occasionally buffaloes and is marked by a short fever, shivering, lameness and muscular stiffness. Also commonly known as 3-day sickness, BEF is an arthropod-borne virus, most likely by mosquitoes. Bovine ephemeral fever is an insect-borne non-contagious viral disease that affects the cattle and water buffalo in Africa, the Middle East, Australia and Asia. In Cape buffalo, hartebeest, waterbuck, wild beast, deer and possibly goats, sheep and gazelles, latent infection can develop. Low levels of antibodies have been found in a variety of other antelope species, giraffes and even pigs and elephants. But the specificity has yet to be determined. The disease may cause serious economic losses through deaths, the decline in condition, decreased milk production, lower fertility in bulls, occasional abortions and delays in marketing. Now, when the disease is so serious, let's have a look at the causes of BEF, an arthropod-borne rhabdovirus known as ephemeral fever virus or bovine ephemeral fever virus is the only cause of it. There are few other names by which you might know the disease: 3-day sickness and BEF, which is an acronym for the bovine ephemeral fever. There are typically 3 recognized stages of bovine ephemeral virus. The acute febrile stage appears suddenly and is especially noticeable in dairy cattle. Affected cattle are likely to show signs associated with fever, have a rectal temperature over 40 degrees Celsius, shiver. In approximately 50% of the cases, you will see that the cows or cattle are shivering, stand with their backs arched and heads held low, muzzles extended, drooling saliva, have discharge from eyes and nostrils, stop feeding and cut chewing, and have reduced milk production, especially in dairy cows. The second stage is muscular stiffness and lameness in one or more limbs. Some secondary bloat may occur due to the general inflammation of the abdominal cavity and ruminal stasis. Lameness may shift between limbs and joints may be visibly swollen. During recovery, most affected animals resume eating and drinking. Animals may go down, with heavy animals in good condition being most affected. Some animals remain down due to muscle damage or damage to the spinal cord from the constant struggling. But how does it spread? While the vectors have not been confirmed, mosquitoes and biting midges, sandflies, are thought to be the responsible ones. The disease can also be spread by the intravenous inoculation of a small amount of blood. BEF is not transmitted by close contact, bodily secretions or aerosol droplets, nor does it seem to be transmitted in semen. Carriers are not known to occur and the virus is rapidly inactivated in meat. The spread of the disease depends on the season and weather conditions also. Rain and prevailing winds are necessary for the survival and dispersal of vector. As we have discussed everything, but how do we control it? Let's have a look at it. For control, there is vaccination. There is a modified live vaccine for BEF that provides long-lasting protection. A 2-part vaccine, freeze-dried vaccine with chilled liquid adjuvant that must be mixed prior to administering. It provides good level of protection against BEF, while some cattle might still develop mild disease after vaccination. The severity and duration of illness tends to be much lower than in unvaccinated cattle. The initial vaccine should be administered twice, 2 or 4 weeks apart under the skin of the neck for long-lasting protection. To ensure that the animal are fully immune, before insect population have the opportunity to breed, you should vaccinate before spring, especially in Northern Asia. An annual booster should be given 8 to 10 weeks before the BEF season. Contact your vet for advice on vaccination program and use of the vaccine. What is the treatment for it? Anti-inflammatory drugs have been shown to reduce the course of the disease. Consult your vet for an appropriate anti-inflammatory drug. Considering the withholding period of the drug for meat and milk. Most animals will recover if given water, shade and food properly. So, this was all about the topic, and for more such content, keep watching Swadeshi VIP. This is Yash Saxena signing off.